It was a gun.
I'm not voting.
If we want to build our nation.
The problem with the Somalians.
Just want to experience something else than a black man.
Move on, move
Can't be like
forward.
a horse with blinkers on.
Honestly say, I was about to have
Corrupt
sex and then I pulled
crap,
up.
but it's nice.
My name is Banele Poni, and I work for Street Talk as a cameraman. Sindisa.
Hi everyone, my name is Sindisa Monakali. I serve as the Deputy Chairperson of Equal Education. I'm also a student. I live in Kailicha.
My name is Bayanda Mazwindumiso. I stay in Kailicha. I work as a curriculum developer for Equal Education.
Hi everyone, my name is Yasanga Vilapati. I'm a facilitator at Equal Education. I'm also a student.
Hello everyone, my name is Aaron Chwabi from Lower Crossroads in Philippi. I'm an artist, man. I'm a life skill facilitator. I'm a radio presenter. I also do contemporary dance.
Hello everyone, my name is Kambi Koro Fikiliyendi. I'm a professional actor and an entertainer, and I have a non-profit organization, and I work full-time for the head office of the Social Media.
Let me just open up by saying that as we are facing with this pandemic, coronavirus, and shifting, how the things are shifting, and the reopening also of alcohol. And then, like, is it wise? Is it wise to open alcohol? Aaron, can you tell us?
Okay. No problem. Lombuzo is a good question, but you're a wrong person, man. I don't even drink alcohol. I've never even drank alcohol. So, but my take, man, is, you know, man, abantu bazofa more because utywala brings abantu more, yabo, baba together abantu when there is alcohol, yabo, and ngokuba kusulela abantu ngele virus once again. So I don't think it's wise, man, for government for again taverns. As we speak right now, Eliqua it's packed. Yabo, bakhona abane mask bakhona bangenazo imask because abantu bayagoloza paphandle, yabona, they're gonna get drunk abantu asilali ngoku because abantu because abantu bonwabile, yabo, and then abantu as mask, they're very careless about, yabo, so it's not wise ngeli xesha into bangabana kuvulwe iliquors okanye utywala, yabo, umbuzo wakho, but yeah.
Tando, can you elaborate on that? Maybe we're drinking.
If you want honesty, I will give you honesty, Mr. Banele. Mr. Banele, under some circumstances, you know, I don't think I don't think it's a good idea, you understand, to open up Uchara at this time, you understand. But we did need, you know, that piece of alcohol, you understand, Mr. Banele. To be honest, you know, there are things that are going to be happening because, to be honest, Monday, you remember Monday, yeah? We were so action-packed Monday, and I saw that this thing of alcohol will never work because you know, no one will ever wear mask, never, you understand? And if you can go around these places, up walking lines, people don't even wear the mask properly. So it was never a good idea, although, but then again, it's not a good idea. I don't think it's a good idea, but I don't know why the government did it and then but I don't think it's a good idea because it's about affect abantu, because abantu abazufunga mask, beshushu and kakuselwa ngokuselelwa ezindlini. You understand? It's not gonna work, Lando. You're saying that we're gonna close the tavern and then people are gonna drink at home. People are gonna drink one at one time. No! People are going to gather there in one place. Just imagine if that there is only one person that is infected there. And you must know one thing about us, ne? You understand? And just imagine if I'm infected and I'm that good, just imagine what's going to happen there. And then you go home to your partner. You understand? So it's not going to work. It's really not going to work. It's just going to keep doubling the numbers. Thank you so much, Mr. Banel.
Thank you very much. I don't want to dwell much on this problem of alcohol. We know that it's not good at all. But in overall, what can be done just to close up? What can be done? Can you Bayanda? What can be done to solve the problem? I know we have to wash hands, etc., etc. But what else?
Yeah, I was not going to be a health professional and just tell you what we need to do. But look, I think Wenapane, we need to be very careful on how we want the levels to go up and down, right? And I think as a country, we should be really strategic when it comes to that. And we should think about what affects, which people are more affected by dropping up the levels and down. And we know by dropping down the levels, the poor people that are vulnerable already to health problems and to health systems that are not working in South Africa are the most affected. Not to go back on the topic of alcohol, but the most people that are sick and cannot access hospitals and good health care are the poor people. And those are the people that access alcohol first because they depend on alcohol for emotional relief, right? So I'm saying for me, when we're thinking about dropping the levels, we need to be really, really careful on who is affected the most because it's not affecting the rich and the upper working class, it's affecting the poor working class. So I'll call for me to stay as much as we can into the upper levels until we have a resolved solution around the coronavirus. That's my
Thank
take.
you. Siasanga, what can you say about that?
I was going to say that we really need to looking at the levels, as Bayanda said already, that we really need to be careful as in how we move the levels. Because one thing that I've seen is that what our country is really most focusing on is the economy, but not looking at who is it really affecting and who's really crying about the economy. It's obviously the people who are not going to be affected when we go to level 3, because I mean, like, they'll be gaining on those levels because they own businesses. And the black working class people do not own businesses, but they'll be mostly affected by lower levels. Because I mean, like, looking at our health system that is already, I don't know what I will say, it's tripled because our health system is just there, but it's not there. Because I always make an example to say, do you notice on weekends on how our day hospitals are full, just because of people being drunk and because of car accident and people fighting and all those things? People will be laying in those chairs because I mean, like, there's no beds. What will then happen when people start getting sick and when there's more cases of people who are poor? In fact, let me emphasize on that, because they don't have medical aids. They will not be going to private hospitals. They'll be depending on those day hospitals who do not even have sufficient beds. So I mean, like, level 3 will really affect, moving the levels will really be affecting the poor working people. So I think that we really should stay in the upper levels as long as until they get a vaccine. Because I mean, like, if you notice already, also looking at the environments where the poor black people stay, we're using communal taps. It's just messed up. It's overcrowded. Once I get affected, then I'll definitely affect the next person. But maybe, for example, going to that tap, maybe, for example, by using that toilet, because now we stay in a small house where there's like 7 people or more, we'll be affecting each other in that process. So I mean, like, even lockdown itself, yes, it's not for us black people, that I understand, but at the same time, it's also to protect us the most, because I mean, like, with the most vulnerable people when it comes to these diseases, because we don't have medical aid, and then also looking at the way that corona spreads and also looking in where we live, so it will spread more faster in the informal settlements compared to Abosikwen, because I mean, like, they have all the land, they have spaces, and then they can even isolate themselves in their homes. Tina, we couldn't even do such things. So I think we really should stay at the highest level and never go down, and not focus on the economy, but focus more on people's health.
Lastly, Sindisa, what can you say so that we can close up?
So the question is, what can be done?
Yeah,
I think it's we need responsible leaders, Tapani. We need people who think. We need our leaders as the country to lead in front. meaning the open parliament. Why they're not going to work? Open parliament, they can go and strategize, they can go and do whatever. Like open parliament, they will go to work. Come to Cape Town, because we're the highest, right? They should come to Cape Town, open parliament, people should go to work. It's time for our leaders to start to be essential workers now. Not staying in home and having a Zoom meeting and all of that, and sending them doctors and nurses on the ground. That's the first thing that can be done. Secondly, we need our institutions of higher learning, even schools, to be changed to deal with this pandemic. For instance, if there are learners or there are students who are doing nursing, who are doing all of these things, we can convert the reds to hospitals so that we don't have overcrowded hospitals to deal with the pandemic. We can have your PhD students or doctors to contribute in the research. This can become their practicals. We can treat it as their practicals. They are at work, do all of these kind of things. But we don't have people who think about those things because, as Lucia is saying, that we are focusing on the economy. And who's calling the shots in this country? I mean, I don't think it's even us who wanted the alcohol back, just to go back for your question. It's not even us. And they're pushing and saying that it's the economy, it's the economy, it's the economy. Let's push for economy. I understand that, but I don't think it was even this was coming from the poor working class background families. I don't think, because their need was just to have food at their homes. But where are our leaders? They should come, because Cape Town is the highest. They should come to work here in Cape Town. Why they are not coming? And to think and to organize all of those kind of things, because they are responsible leaders. I'm sure they will be wearing masks. There will be social distancing, and their homes are even bigger. So I think we need not to treat this as that we are in a hurry. We are Asnamanga. We are not in a hurry. We must think. We must be able to deal with this, because it's not as if we are in a hurry. Let's do this. Let's open schools. Let's open the economy. Let's do this, because the numbers are going to increase, obviously, because we're going to interact. People are going to be happy, and all of those kind of things. So we need not to treat this pandemic as if we're in a hurry. There are so many pandemics that happened in the past. There are Spanish flu. There are all of those. Let's take lessons from all of those pandemics and stop treating like we can change the calendar. Even if December becomes June next year, you can change everything. We have the power to change. Stop treating this like we don't have it. Like we're in a hurry. Let's deal with this. No. Let's change everything if we have to. We can end the Christmas can be in June. I'm sorry to the Christians, but Christmas can be in June.
Thank you very much, and I think we've covered a lot. My dream is to see South Africa in solidarity and working together. That's my dream.
So my dream is to see a liberated youth, a liberated generation that is conscious and aware of their surroundings, and actually who are working towards liberating others and actually being more conscious about what's happening around them.
My dream is to see South Africa being led by youth and the people of the working class organizing and overthrowing capitalism.
My dream is to run a youth center, man, to empower, inspire, and also to give Abantu, especially Lucha, a skill to discover themselves.
My dream is to see all those people that are becoming successful people and becoming entrepreneurs. That is my dream. To see all those people that look so hopeless being hopeful and being led by faith. That is my dream.
My dream is to see a decolonized South Africa.
Yazi, you should ever sit and talk with people, or else take a walk and create a straight talk. Talk what is nice, it will make you feel stronger. Listen what is right and say what is wrong. You should ever sit and talk with people, or else take a walk and create a straight talk. Talk what is nice, it will make you feel stronger. Listen what is right and say what is wrong.